This is not that good. Do you have top of the foot nerve pain? There's nerve pain. There's bumps. There's jamming and bending, big toe joint pain, top of the midfoot pain. We've got you covered for all types of top of the foot pain, the stretches, the exercises, the massages. I don't even know what else I can say during this intro to get you to keep watching, but we're starting right now. The key to top of the foot pain is proper diagnosis. You can see here, you have a lot of muscles, you have your nerves, you have bumps. So you can see right here, see these joints, you have the big toe joint. We're going to go over all these, but you want to go see your podiatrist if you have a serious injury. You want to get an x-ray. You want to get an ultrasound. If it's a lump or something dangerous looking, you need a biopsy. You might need an MRI. All these things can help. They're impossible to answer online, but this is meant for general top of the foot pain. And these things do work. But if you have a specific problem, always get checked out. That's the best way to know, especially for top of the foot pain. There's a lot of different causes, and proper diagnosis is why people suffer, because they don't get the proper diagnosis a lot of the time. The nerve up here is called your superficial peroneal nerve. What happens is if I punched a nerve, it can stay bruised for 1 week, 2 weeks, 1 month, 2 months, up to 3 months. Depending on nerve classifications, you could be doing all the right stuff and your nerve is still sore for up to 3 months. That's just the reality of injuries. You know, just like an arm bruise, if somebody punches you in the arm, same thing happens to your nerves. It can fill up with fluid. It can stay swollen. So keep up the good treatments, the icing, the anti-inflammatories, the massaging. All this stuff takes time to see results, especially with your foot because you're walking on it every day. The lump on top of the foot, you could have arthritis. This is called Hallux Rigidus. Your big toe joint can't bend up. This is a very common problem. Very common in men and women ages 30 to 50. What I see is women tend to have bunions more, but the bunions can become arthritic. And men tend to have straighter toes, but that they become arthritic from standing all day. When the foot flattens out more, so the more flat-footed you are, the harder it is for your big toe joint to bend up. As your joint rubs against itself, extra bone forms, and then the joint gets stiff and can't bend. You lose your cartilage. It becomes stiff and painful. So what we find is surgery is an option, but it's the last option. Very rarely do you need surgery. And even when we do surgery and completely clean out this joint, if you're still doing the things that caused the arthritis in the first place, it's not going to get a whole lot better. Again, the key is great shoes, great inserts. The majority of patients feel a whole lot better. But again, see your podiatrist, get it imaged. Middle of the foot arthritis. So this is called right here. See this joint that I'm bending and breaking? That's your metatarsal cuneiform joints. So right through there, that right there, as your foot flattens, you can see the joints jam. See how they're jamming right there? As those joints jam, and you're becoming flat-footed, the arthritis wears away. So it's almost like uneven punching. So this is why people get plantar fasciitis. The bottom of your foot stretches and the top of your foot compresses. So you could see all the stuff at the bottom here. This is stretching. That causes plantar fasciitis. And the top of the foot flattens and compresses, and that causes arthritis. That's called a metatarsal cuneiform exostosis.
Most people have one foot that's tighter than the other. So you can see here, my left foot has more ability to bend up, but my right foot doesn't. That's going to make the top of the foot, those joints crush, and the big toe joint's going to crush, and it's going to jam, and that's going to lead to arthritis. So again, my left foot's looser there, but you can see the right foot can't bend up. So the top joints just compress more because the ligaments and the Achilles tendon can't stretch to compensate. That's the true cause of the top of the foot pain.
This then puts pressure on the nerves on top of the foot. That's the medial dorsal cutaneous nerve. And what happens is that then causes sharp shooting, radiating, tingling pain when you're standing. You get red bruising. So what's the treatment? You can do surgery, but that's the last option. Very rarely do we ever need to do surgery to shave away that bump. And even then, the pain can come back because you're doing the same thing that caused the arthritis in the first place. You can decrease the inflammation with a steroid injection to diagnose that that's what the problem is. But that's more of a test. It's not more of a solution. Again, you want great shoes and you want a great orthotic. Check out a shoe like this. If there's no support, the top of your foot is going to squeeze like this. See that? These bones are going to jam right here. Whereas a good shoe, look, I can't bend it. That means this doesn't bend. It bends more through your Achilles tendon rather than through the middle of the foot. So that's the real difference. You got to get a shoe with some support. And even better is the orthotic. So watch this. When you land on your foot like that, look at how it bends. So this isn't a trick. This is really what your foot does. Whereas, watch this right here. I'm pushing down. The middle of the foot's not flexible. Look at, it's through the Achilles tendon. It's not through the middle of the foot. With an orthotic, you don't get a bend like this. That's what really helps the top of your foot. That's how you stop top of the foot pain. If that's still not doing it, and we start this off right away, you want to take your shoes and you want to feel on your shoes where that bump is rubbing. You want to skip these laces. So you can skip the laces around it. So 2 or 3 holes, you can skip them and you can see the shoe is now no longer rubbing on the bump. The tough part is people switch to like sandals and stuff like that, but the sandals aren't giving you as much support, so the foot's compressing on top, even though the nerve's not rubbing. You can have a golf ball sized lump through your arch right here. That is called a plantar fibroma. If you do have a lump in your arch, so if you bend your big toe upward and the lump becomes more prominent, that's likely to be a fibroma. Click up here. This is our plantar fibroma guide.
A great way to both massage and ice your foot is to freeze an ice bottle. Even though this is the bottom, this is loosening up and decreasing the inflammation of your plantar fascia, the bottom ligaments. This makes your foot bend easier. Your big toe doesn't jam as much. The top of your foot doesn't jam as much. You could even grab a bag of peas. I always love a frozen bag of peas. Put it on top of your foot, or massage the bottom. This will loosen it up. You can also roll a bottle on the back of your calf muscle to loosen up your calf muscles. But the key is it's not really practical. That does 2 things. It massages, it ices, put a bag of peas on top of your foot. Heat is a good option, but studies have shown ice is better. So stick with ice if you can. This is a little heat bag right here. Stick with the ice if you can, 20 minutes at a time. This is a cryosphere. There's some products out there. This can work well for your upper body. I find it's better for that, but it can work well for your calf muscle. It can work well for your arch, but it's a little bit more difficult to get on the front of your foot. But it's good for loosening up your thigh muscles, any knots in your legs, because the top of the foot pain is really a symptom of a tight rest of the leg. You're simply putting more pressure into the front of your foot. So ice decrease the inflammation in the rest of your leg and loosen up the front of your foot. A massage roller is great too. You want to not only ice, but you want to get a massage roller stick. This is like $7. You want to loosen up your leg muscles, your calf muscles. That lets your foot bend up more, and that puts less pressure on your plantar fascia at the bottom here as it's loose. It puts less pressure on your big toe joint, the top of your foot. This seems paradoxical, but this is really the key. You have to focus on stretching and loosening up your leg to put less pressure on your foot. Otherwise, it makes no sense. Use the ice ball. It works great. And this is really the key. So right here, you can see my left foot bends more. That's less pressure on the top of the foot because the Achilles tendon can absorb it, but the right foot's tighter. So when I step on it, right there, the joints in the middle of the foot are getting crushed on the top. So left foot, less pressure on the top. So those joints are swelling more. It's putting more pressure on the nerves. It's putting more pressure on the back of the toes. That's what causes top of the foot pain. Great stretching devices are a foam roller. And again, the key here is you're massaging out your glutes, your hamstrings, and this lets your foot land with less pressure through your plantar fascia, through the top of your foot. Studies have shown loosening up these muscles for like 2 to 4 hours or 6 hours or even 8 hours. There's less pressure on your foot because these muscles are more flexible. They can absorb more stress so that the top of your foot and middle of your foot don't have to. This stops the joints from getting jammed. So use the massage roller stick, use the foam roller. These balls with the little rubber nubs on them can loosen up the plantar fascia so there's less jamming. So roll out the ankles. When I get up in the morning, I always roll these out, especially if I have an injury, is what I would say to athletes. And then these half moon devices are available for like $10 to $15 online, maybe more now with COVID. But I recommend getting a double one. I love the double ankle slant board. I have some of the recommended ones in the links, but you can find these anywhere. And what happens is you start at like 15 degrees, move up to like 20 degrees, move up to like 30 degrees, and your hamstring, your calf, your glutes are absorbing more pressure so that the top of your foot doesn't have to. This stops the jamming on the top of your foot. So you can see I'm moving up the levels right here. But what happens is if you're not wearing a shoe and if you're not wearing the orthotic, you'll notice these really hurt the top of your foot if it's already sore. So you want to be in an orthotic so it holds your foot pretty straight. And this prevents the top of the bones from jamming, and it makes your heel, your calf, and your hamstring absorb all that stress so the top of the foot doesn't have to. So you can see right here, the top of the foot is now offloaded while I'm stretching my calf muscles, my hamstrings, which are now ideally massage rolled and foam rolled. And you can see in these shoes, in these orthotics, there's pretty much no pressure on the top of the foot. These devices work great overall. And then if you don't want to buy a device, realistically, just stretch, use a towel. The towel works really great, but what you want to do is you want to make sure the foot is turned in. You don't want the foot to just twist out through the ankle. If it's twisting out and your leg's turning out, you're just re-damaging the top of your foot. So you can tell, if you're doing that, and the top of the foot's hurting more, you're doing it wrong. Right here, you want to step on the towel. And again, your feet need to be turned in a little bit. And you don't want pressure on the top of your foot while I'm doing this. And then you stretch your groin, your hips, your hamstrings. These all take a lot of pressure off the top of your foot. That's what really makes the difference.